I think the most important thing that we can do to engage physicians in improving the value of care is giving them a firm understanding of the finance and organization and structure of healthcare delivery. I think one of the things that's really missing in our industry is an appreciation for the gaps that we all have in knowledge that end up, I think, creating real missed opportunities for actually bridges to be built between folks who work on the financing side of healthcare and folks who work on actually delivering healthcare. We have an opportunity right now in this country, I think, to really transform healthcare because of the ACA, because of MACRA, because of the HITECH Act. We're in a very, very special moment. But I think that physicians are suboptimized to actually deliver on this moment because they don't know a lot about the financing and organization of structure of healthcare delivery. And at the same time, folks who work on the finance side of healthcare delivery don't necessarily understand clinical medicine with the level of specificity that they should. Mm-hmm. So I think that there needs to be a bridge built between physicians and folks who work in the business of healthcare that's based on a common understanding of facts, common understanding of clinical medicine, common understanding of really how our healthcare system is organized to deliver outcomes for patients. One of the worst things that we have going on in our industry right now is the buzzword bingo that we play with high-value care, population health, innovation, transformation. Ultimately, these are not terms that physicians really connect with. And so physician leaders who truly want to move physicians to deliver high-value care will really focus on the diseases that physicians were actually trained to take care of and help them understand from an epidemiological perspective how we can actually improve the care of patients with these conditions that we've been trained to treat. Most people didn't go to medical school because they wanted to be population health experts or value-based care deliverers. They went to medical school to take care of patients. And so if you really want to engage physicians in taking better care of patients, engage them in taking better care of patients. Don't engage them in these terms that mean nothing to them. I think physicians intuitively understand that value-based care is good for patients, and it's not a bottom-line driven initiative. But I think there's a language of how these things get communicated to physicians that's getting in the way of them seeing that. At the end of the day, most physicians want to take phenomenal care of patients, and I think a lot of the language that's emerged around the value-based care industry really focuses on outlier bad behaviors instead of really appealing to the positive instincts that exist within most physicians to take great care of patients. I think leaders who want to drive population health agendas, value-based healthcare agendas, need to appeal to that better sense that I think exists within most physicians. And we get caught up sometimes thinking about outliers instead of the median physician within any healthcare system that wants to do right by patients, wants to do right by families, and wants to do right by our healthcare system, more broadly. But the communication, there's, change. This is a big, massive change management effort. Changing our industry from fee-for-service, volume-driven care to, value-based payments and value-based care. And we have to treat it as such as an industry. We don't treat the change that's happening right now as, fundamentally the biggest change management effort that's ever existed within American healthcare. That's what this is. This is the biggest change management effort that's ever existed within American healthcare. Who's leading it as a change leader? When big corporations go through change management efforts, they hire consultants, they develop playbooks, and they move with deliberateness and with some real speed. We don't have any such effort within healthcare. We're trying to manage a 21st century healthcare delivery system with 19th century change management methodologies. And I think we need to catch up with the rest of industry and think about how we can bring people along in the ways that we know we can.